All right, so it's 1:02. Are we allowed to begin? All right, we're gonna get started. All right, great. Good to see some familiar faces in the chat. So welcome everyone, and I know still people are coming in, but thank you for joining us for our webinar on equity and aging, what will hopefully be the first in a long-term ongoing series of webinars focused on the topic. I'm James Fuccione from the Massachusetts Healthy Aging Collaborative, and proud to bring to you today Antron Watson from AARP-Massachusetts, Samantha Hamilton from the Public Health Institute of Western Mass, and Michelly Santos from UMass Lowell that helps coordinate and lead the Lawrence and Lowell age and dementia friendly initiatives. And we have Mary Catherine Miranda from JSI that is supporting all of this and making this webinar possible. So thanks to the panelists and thanks everybody for joining. We have almost 200 people registered for the webinar, which is a great sign, a good indication of the interest and strength around this topic and why we're doing this. We're going to focus in this first webinar on what we have kind of begun to do to address equity and aging and the age and dementia friendly movement, sort of statewide, but also have a couple community leaders give examples of what's been going on at the community level or regional level as well. We're going to be recording the webinar, posting it along with the resources that we shared today. It's going to go on the Mass Healthy Aging Collaborative blog and newsletter. So, you know, we debated whether or not to say that we're recording so people will join, but we are recording the webinar. It's going to be posted on our blog for folks to see with the resources, like I said. One of the main things we're going to share is a Google form to assess interest in a committee of the same name, Equity and Aging. And so the purpose of this group is going to be to focus on and elevate the work that's going on in communities, within organizations to address equity and aging so that in future webinars, we can highlight the work that you're all doing, but also bring just an immense amount of experience and expertise to the existing MHAC network of stakeholders and communities, which is very broad and it's statewide, but you know, we can do a much better job at kind of taking the immense amount of resources and funding opportunities and all kinds of just stuff that we have to help communities kind of take on this work and do so in a more equitable way. So in the form, what we ask is that you briefly describe work you have done or are currently doing that addresses equity and aging, and it can be pretty broad. We're going to have a guide that we're going to show in a slide in a few moments that sort of shares how broadly we're sort of thinking about this. But you know, if you are a council on aging that has run, or an aging service access point, or any stakeholder that's run a program for LGBT older adults or focused on diverse populations or older people living with disabilities, you know, you bring like an invaluable amount of expertise and experience to this group. And so that's what we're trying to do, is build partnerships, connect, raise awareness of our sort of collective and common work, and sort of extend the value that MHAC has in bringing people together and convening groups to kind of make our network, you know, more equitable, more focused on equity and aging. So we feel there's an opportunity to highlight your work and get all these resources to a wider audience. So, you know, we're going to have a few presentations, but we hope, as I said, future presentations will focus on what you're all doing in communities across the state and help us share a lot of resources that can benefit communities and organizations. So with that, I am going to start sharing my presentation, and then we're going to get to Antron Watson from AARP-Massachusetts, Samantha Hamilton, doing great work in Springfield and the Pioneer Valley, and then Michelly Santos from UMass Lowell. All right, so just a quick share of just the Mass Healthy Aging Collaborative If you're unaware of sort of who we are and what we do, we're a broad statewide network of communities and stakeholder organizations sort of across the spectrum that have come together to advance inclusive age and dementia friendly communities. That includes deepening capacity building for communities, but for the purpose of this presentation, embedding access, equity, and inclusion within the movement. And so the age-friendly community movement, having started at the World Health Organization, their definition of an age-friendly community is that, and I won't go over all this, but an age-friendly community is accessible, equitable, inclusive, safe and secure and supportive, and recognizing that older people play a crucial role in their communities. And so in building out the framework, if you've seen the age-friendly sort of 8 domains, we have expanded on that thanks to a very strong and robust dementia-friendly community movement in our state, with tons of great, I mean, at many times national leaders in dementia-friendly programs, policies, and practices. So we have combined two very similar movements in age and dementia friendly to come up with this framework. And this is what communities engage in when a community, a city, town, or region makes a commitment to join this movement. These are sort of the menu of options and the different focus areas that a community can pursue to become more age and dementia friendly. And so one thing we've added to the list is access, equity, inclusion that you can see on the right. But even though it's its own separate sort of theme, it runs throughout all the different themes. Massachusetts, thanks to the Executive Office of Elder Affairs, is the first to come up with an age and dementia friendly integration toolkit. Within that toolkit, if you kind of dig into it, you can see that the first focus area is access, equity, and cultural inclusion, and there are resources to help communities have discussions and pursue action in all these different focus areas. So that's one area where you can see resources to help communities along in a more equitable way. What we have also focused on from the beginning of this work is focusing on social determinants of health and access, equity, and inclusion. So this graphic you see is a sort of well-worn, very popular graphic displaying social determinants of health. And you can see the highlighted sort of column on community and social context. But again, this runs throughout all of these different themes and domains and focus areas. But what we say is what we say to communities is when you're convening a coalition, when you're looking at resources or community factors, these are different stakeholders. Stakeholders in these different areas are folks that you want to convene and invite to the table, or at least engage in the assessment process as communities build an age and dementia friendly action plan. And in going deeper on this data, we're lucky to be supported by the Tufts Health Plan Foundation, and that the foundation also supports UMass Boston in creating a Massachusetts Healthy Aging Data Report. So it was last updated in 2018, but it shows, if you go to our website, you can click on Data Report and you can get a statewide sort of highlight of just different themes that run across, health and wellness statewide. But what we always focus on is what's down in the bottom left-hand corner that says where you live matters, at just a nod to social determinants of health. And that's even more sort of highlighted if you go to the community profiles. So as part of this report, we also have profiles on all 351 cities and towns in the state, where you can see on a deeper level what the experience of older adults is according to the data in every community. So during the pandemic, UMass Boston has taken the Healthy Aging Data Report and sort of expanded and highlighted different factors, including racial differences in behavioral health, chronic disease, and disability indicators. And so this chart comes from the UMass Boston Gerontology Institute's Black Lifetimes Matter report. And so these are all indicators for folks 65 plus, the disparity between white and black and all of these different um, health and wellness indicators. And what UMass Boston found is when you balance out the data for other factors, it is the social determinants of health, economic security, education, neighborhood and physical environment, employment, and access to healthcare that really matter and that really make a difference in driving these disparities. We're also fortunate, and it was great timing on the part of UMass Boston to also release a report, Aging Strong for All, which examines health and aging equity in the city of Boston. And we were able to benefit from UMass coming up with a definition of aging equity, which means in this report that everyone has a fair and just opportunity to age well. And I'm not going to read the rest of this paragraph, but again, it's a nod to social determinants of health and how much these factors really matter when when we're working to advance inclusive age and dementia-friendly communities. And then an article in the American Society on Aging blog just kind of goes further on this to say that there's an opportunity that age-friendly initiatives, and I should say age and dementia-friendly initiatives, are natural facilitators for developing equitable aging environments. And so one way we're trying to take advantage of this opportunity and get communities pursuing age and dementia-friendly work to discuss and take action on being more equitable and inclusive is our Healthy Aging for All guide. This is a resource that came from, it went through several rounds of review and discussion in all kinds of different groups. We had an Access, Equity, and Inclusion work group. And then the MCA at MHAC is the continuation of what started as the Multicultural Coalition on Aging. Some of you may be aware of that group, or you may have participated in the group, but we are really continuing their legacy and the legacy of the members that have decided to continue the work with the Mass Healthy Aging Collaborative. And also Age and Dementia Friendly Framingham was another venue that we have sort of tested and refined this guide over time. And this guide is actually being currently piloted, even though it's publicly available. It's being piloted in Framingham, in Lowell, and in the Pioneer Valley region with a handful of communities out in Western Mass. And so the centerpiece of this guide is this Inclusive Communities Crosswalk, and it may be a little hard to read, but I'll talk a little bit about it. Along the top horizontal axis, you see sort of the age and dementia-friendly aligned framework that we talked about, including that custom theme all the way to the right acknowledges that communities may choose any combination of these, and they may choose to focus on a completely different theme or a more in-depth version of one of the existing themes. But once a community sort of identifies which focus areas are of priority, then we encourage communities to have a discussion about who is impacted, who has access, and et cetera, for all the population groups on the vertical axis along the left-hand side. So you see age, behavioral health, country of origin, dementia, disability, economic security, and so on. In location, I just want to say is a nod to the fact that we want to encourage communities to not just engage, but work towards having an impact in every part of a community, not just certain parts of a community that are able to show up or answer, to easily show up or to answer surveys or engage in listening sessions. And so when we look at this crosswalk, this is also going to guide us in creating the equity and aging group. We are going to try to fulfill all of these different areas as much as possible, and we're going to be pretty flexible with the types of organizations and communities that can come in and lend their expertise to the MHAC network and to the other members of this group. And just the other part of another part of this guide is a worksheet. So not just talking about the intersection of age and dementia-friendly themes in different population groups, but how is the community going to take action, and who might be assigned responsibility for coordinating and reaching out to different groups, or to just figuring out who's missing from the table, and so on and so forth. Part of this guide, we took the cue of a lot of experience and work that came before from Mass Public Health Association's Health Equity Policy Framework, a lot of great work from the Mass Department of Public Health. You can see the community engagement standards for community health planning guideline. There's lots of great work done and tools in that for communities to use, and also the Metro West Health Foundation's Building Inclusive Communities guidebook. And more recently, something that isn't in the guide yet, but we probably added to the guide, is a report on the left-hand side. You see how innovative community responses to COVID-19 support healthy aging. That is another report supported by the Tufts Health Plan Foundation, conducted by FSG, that focuses on 6 communities and the adjustments and innovations and pivots that communities made that supported older adults, and there's a lot of great resources in there to find on equity and inclusion. So that is my part of the presentation, and I'm going to kind of return again to close things out, but I wanted to turn over to Antron Watson from AARP-Massachusetts, who will do a more proper introduction of yourself and talk about the resources that AARP brings to this movement as well. So Antron, thanks, and take it away. And unmute yourself. You all set? No sound. Hold on. Oh, one more try. Third time.
There we go. Thank you so much for unmuting me there. Thank you for the intro. I'm Antron with AARP Massachusetts. My main role is really working with our age-friendly communities in across Massachusetts. I think right now we're up to about 74, 75 communities here in Mass who are committed to making their communities more livable for people of all ages. And with that, we realize that age-friendly can be used as a tool for equity when having these discussions, because it really does provide the context for addressing the disparities. Equity is not necessarily always mentioned in the community's action plans or in their surveys, but what it does help communities do is to establish the goals and activities to deliver the more equitable outcomes that they're looking for. And it also touches back to the core values of the work, especially in the cases when equity is not explicitly mentioned in the action plans. But ultimately, when the communities are going through the process of listening to their residents and communities, sorry for that, they're really committed to elevating the voices, the concerns and needs and wishes of all of their residents. So one of the things that communities have really committed to doing is targeting their listening sessions to the residents that they don't hear from often. And actually later on, we'll kind of see a couple of slides where that shows up and can show up in communities as they try to make their communities more age friendly and with a focus on equity. One of the big things that's really important across this is partnerships. James mentioned it. I think all of us on the call today are really focused on partnerships because the work is being done by organizations who have those ties in the communities. Our organizations sometimes are statewide, don't always have those specific connections. But the examples here, especially in light of COVID starting, reaching our residents where they are and having the organizations who have those very granular connections is important. We see here in New Bedford, really around food security, the number of partners who were at the table and who were able to make an impact in that space, especially considering the Wampanoag tribe, as well as the EMS who joined into this process, really engaging and meeting people where they are. Having culturally distinctive programming is very important. One of the, I always touch back to Boston, who when they were starting this initiative, holding their listening sessions in the communities, going to the churches where people are currently meeting, having the listening sessions in language is important. They were able to do a number of sessions, including in Chinese and Haitian Creole. But really, again, meeting people where they are, having organizations involved. This is a collaborative effort. It's not, not just on the city. I think really relying on our partners and creating partnerships is huge in a successful age and dementia friendly process. Another one, that issue we've seen, not only here in Mass, but nationwide, is transportation. There's several communities who are working to make complete streets, and really focus on communities with lower incomes and neighborhoods to gain better access to transportation. I know Shelley's going to actually talk about some of the work that they've done in Lawrence, especially with the free shuttles. And then prioritizing place. A lot of communities are focused on their parks and public spaces. And what does that look like for gathering, and what are communities saying? So an example here in Chelsea, as you can see here, they focused on a thoroughfare that was heavily used by folks who are walking, bicycling, but wasn't the best location. What they don't mention here is that this was focused on a heavily Hispanic Latino community. So the artwork that they did helped create that place for the community. They had ownership into it. They were brought to the table. I believe some of the murals that were created were in Spanish, just to, again, bring that awareness and ownership to the work actually taking place. Most importantly, AARP is one of our big things, is really about supporting our seniors and using our platform as a means for elevating the voices of the residents in the community. A number of communities across Mass have explored a civic academy, which is directed at really educating residents on what it means to go to city council meetings or town meetings, and how to advocate, and making them aware, or empowering residents is really the focus of it, right? And hope so that they have an impact on the outcomes that are taking place in their community. As we talk about equity and that ownership, and really focusing activities of this nature in those communities where people aren't always having their voices heard. This is what the work of some of these civic academies have done, is to elevate those communities, those residents who we don't often hear from. And then lastly, if all of this works together, beautiful picture, we'll have improvements to the government. Hopefully approaches can expand to transportation, housing, municipal services options, and really create more opportunities in our communities for change. And lastly, resources. AARP is constantly rolling out new resources. If you haven't already, please visit aarp.org/livable and sign up for the e-newsletter. There's constantly great examples from across the country where they're trying to highlight work in the equity space in varying areas, be it just equity in transportation, housing, connectivity, across, honestly, the focus areas that James mentioned in his slides. And there's always new reports. And obviously, I'm also a resource here in Massachusetts, and I'm going to continue to work with James and the other panelists here to hopefully highlight more of what's happening here in Massachusetts, because there's some great opportunities and great things taking place. So thank you, James.
Thank you very much, Antron. And whether you like it or not, you are working with me, and I appreciate you being a partner in this with everybody else at AARP. And wanted to circle back just to say about the dementia-friendly movement, the backbone organization leadership for the dementia-friendly communities is the Mass Councils on Aging. So we'll hopefully have more information on that movement and work at Councils on Aging in future webinars. So I wanted to transition now. Again, thanks, Antron. We're going to go to Samantha Hamilton from the Public Health Institute of Western Mass, doing some great work in Springfield. And so she's going to share, again, a better introduction of herself and her work and what's going on in the city of Springfield. So I'm going to get Samantha on here in a moment.
I'm here. I need to enable the host to enable my camera.
Oh, okay.
Thank you.
Yeah.
Hi, everyone. Thank you, James. Thank you, Antron. So my name again is Samantha Hamilton. I am the Lowell Springfield Program Manager under the Public Health Institute of Western Mass. The work that we do is around community organizing and convening. The Public Health Institute is also a research and an evaluation nonprofit that works with other partners across the region to evaluate various initiatives, health disparities, and other issues happening in the Valley and across the state. I want to speak specifically to the work that I am doing with our age-friendly efforts in Springfield. And I'm going to share the slide, and I'm going to be intentional to talk about one of the specific equity issues that we've learned about in our community. And I want to recognize that equity issues vary depending on community regions and neighborhoods. So what one community might be dealing with across in the Boston area is not necessarily what the Western Mass region is dealing with. But some of these equity issue gaps do hit regionally, statewide, and beyond. So these are things that once we bring it to everyone's attention, we might find some solutions for in our community across states. So I don't know if folks can see my slides. Stop sharing. Let me share it, make sure it's being shared once again. So this slide is again to talk about the Live Well Springfield Age Friendly Coalition. I've been working with age friendly work for the last two years. And our age friendly effort started in July of 2017 with funding received from Tough Health Plan Foundation to look to do an assessment of housing and transportation. And we, from that assessment time, we had 2 years to work on what would we do in Springfield to understand the housing and transportation needs of residents. And we recognize that the age-friendly domains, there's various one of them, but in our community, we decided to prioritize these two buckets based on what the community was telling us. From our efforts at the end of our grant year, we were able to designate Springfield an age-friendly city. We hosted a summit to celebrate that accomplishment. But along with that, with partnerships and collaborations, we were able to designate Springfield also a dementia-friendly city and an age-friendly hospital system. We are the first in the nation to have triple designation in one community. And that means our work going forward is super intentional in saying, how can we work across these sectors to understand how to make a livability for all in Springfield? And in addition to that, going into 2019, we received continued funding from Tufts Health Plan to look at community health services and housing and transportation domains. We started off by establishing subcommittees to work on these issues. And then in January of 2020, we all experienced COVID and had to pivot our work and did emergency responses for older adults at that time. In our housing assessment, I want to recognize that we did a lot of community conversations and community focus groups to understand what the housing barriers needs were for older adults. Out of that discussion, out of those listening sessions, we heard from an older adult man that they were facing barriers in accessing housing based on his quarry. And this person was in his 60s and still had issues in accessing public housing. And that became a very interesting and predicament for us to consider, that older adults with previous criminal background histories still have access barriers to housing. And for that reason, it makes it hard for them to live and grow and age well in Springfield. So the Public Health Institute applied for funding to do a health impact assessment. This health impact assessment really looks at what is the policies and practices that are happening in the housing systems that could be perpetuating inequity issues for older adults and older adults with quarries. So this assessment is being conducted right now by my colleague, Kim Gilhooly, who's done this year-long work of really putting together an understanding of what is the landscape of this equity issue. So right now, what I will be sharing is the snapshots of the voices of what the community residents were saying when it comes regarding this equity barrier. And it is an equity barrier when you think about the folks entering the criminal justice system. Predominantly, these are people of color. The folks leaving the criminal justice system are predominantly people of color. So the inequity of being in the system is going to live with them across their lifespan. So we want to recognize that there is inequities in just understanding the gaps for accessing housing for older adults. So one of the things we want to recognize is that older adults with criminal backgrounds are a low risk of crime, but they're a higher risk for homelessness and housing instability. This was a kind of a aha moment when I heard about these findings, but it's interesting that as you get older, you're less likely to recidivize. And this variable says you are less harm to the community, but the barriers of accessing housing stability has been removed from you since the beginning. So there's no point there is a consideration to reconsider the risk factor of an older person when it comes to accessing housing. So when it comes to risk of, again, of recidivism, someone shared that one finding shared that housing providers should have a flat policy that older adults, being an older adult itself is a mitigating factor. If a person is over 50 and hasn't recidivized in 7 years, they are very unlikely to do so. So this factor of being an older person, it says you're less harm. And you can see the statistics that nationwide, 43% of folks, of individuals recidivize within 3 years, while 7% of folks 50 and 65 are less likely. And then if they're older than that, if they're 65 and older, they're 4% less likely to commit any crimes. But why are we holding older adults at the same consequence as being younger and more likely to cause harm in a community when they're perceived to be less harmful? So again, I want to recognize this is a snapshot, and the value of this research is to hear the voice of the community. And in doing equity work and equity assessment in your community, it's very important to be intentional to speaking to the people that are most impacted. So this survey, these survey findings were conducted within our community with the partnerships from MOCA, which is a Men of Color Health Awareness organization, and New North Citizen Council, as well as the All-Inclusive Social Support Services, the Hampden County All-Inclusive Social Support Services. So they helped us with a survey tool, kind of narrow down to the questions that we want to ask older adults. The criteria were that they were interview style surveys conducted in person following COVID safety parameters and or remotely. And then these were multiple choice questions and open-ended questions that were conducted for an hour. And then the eligibility criteria for folks to participate, they had to be 50 years or older, denied access or evicted from housing in Hampden County due to their quarry. And we recruited participants from MOCA, the organization, who engage these communities of color, and New North Citizen Council, and AISS. And the data collected was also administered by these community partners who helped us reach out to those that were in the study. So one of the biggest arguments is, the fact that folks were paying for a debt that they've already served. So some of the feedback is that a resident shared is that I've applied in all of these places. Because of my criminal history, they deny me. I feel like I was still being punished for the crime. I did what I had to do for it. So, folks are feeling that, if I did serve the time necessary, why am I still being penalized for this offense? And one of the biggest instabilities when it comes to being out of incarceration is, where are you going to live and where are you going to work? And a quarry is a big variable factor that prevents that. So the impacts of that has happened to African-American men and Latino brothers and women has its impacted us to not just affordable housing, Section 8 and other affordable housing. We know that quarries impacts people's lives. It is a structural racism that's within the system. I believe that once you do a crime, you serve the time, and that should be it. And if you really did turn around your life, you should have the equal opportunity. And if you're really turned down your life 180 degrees and your hearts and minds changed, you should have a chance. So these are the voices of real people saying that they don't understand the double jeopardy for not having access to housing. So some of the barriers to affordable housing folks shared is that 87% of respondents identified the quarry check as a barrier to accessing housing. So 87% saying even this document is going to prevent me to access housing. 50 of those respondents have chosen not to apply because they're already assuming that they're going to get denied for housing as well. And then 82 of those respondents have been denied that have been denied for public housing or other affordable housing based on their quarries. So there's this perception of that this is an existing barrier. There's this fear of even applying because of fear of being denial. And then once applied, there's a standard in which they do get denied. Another resident shared, honestly, my involvement in the legal system has destroyed any chance of housing I've tried to obtain. So again, it's saying this is living with them. Some of the statistics based on the surveys that was conducted and the interviews by the residents were a conversation of the process of being denied. When are people told that they are not going to have access to housing? So 42% of folks said, I was told not to apply in the first place. So there's this perception based within the system that you're not going to have access. So 16% were denied during the application process. 29% while on a waiting list, and we know these waiting lists for housing is significantly long. And then afterwards, 10% once they got to the top of the list. So the barriers consist in the whole process of feeling you could apply, denied on the way to the point folks were denied at the end. Several respondents state that the housing authority staff told them not to apply because of their criminal background. So it's being told to them that you don't have a chance to access housing because of this criminal history. And what were the reasons given for their denial? So some folks were not eligible, 23%. 94% were denied because of quarry. 29% inadequate income, and then 36% based on their credit check, not having a good credit history, and then 3% for other reasons. So again, just want to showcase the barriers of accessing this sustainable opportunity is not readily available. So again, like I mentioned before, there's a pipeline process in which communities of color are the ones being incarcerated, and once they get out, they have barriers to accessing housing after the fact. But another point is that it's the time in which that they're still being denied, the look back period. They could be on average 12 years removed from the criminal history of leaving the incarceration and still being denied. So people continue to be denied for criminal background long after their official look back period. When we heard stories of people having been arrested 11, 12, 15, 20, 30 to 40 years before, and despite not having been involved in any more criminal activity, still getting denied. And among survey respondents, the average time elapsed from incarceration was 12 years. One of the residents shared, they call me a felon. They tell me I wasn't eligible because I was arrested for drugs. It was over 12 years ago that I was released. I did 8 years time. So it was over 20 years ago that I was incarcerated, and they still hold this against me. So another point I want to share is that people facing barriers to going through to at least the appeal process, there is still a barrier in which folks want to even try that pathways. So of the 82% that have been denied their queries, 32% chose to appeal, and of those appeals, 30% was approved. So it's very slim, even once you've been denied access to housing, that your appeal process will be successful. And another voice again shares, she told me that they're going to deny me anyways. So I just didn't even go through the process, because to me, at that time, it didn't make any sense. I'm just lost out here in a system because of my query. My background, I don't have anybody to help me do anything, really. They did query checks now and they do credit checks now, and my credit sucks due to me being incarcerated and not being able to build my credit. So there's a double barrier jeopardy with adding a credit check along with a query check to someone's criteria for qualifying for housing. And then lastly, they asked for an exorbitant amount of information, which is tedious at best, in regards to trying to get housing assistance applications, or asking for information that as a person struggling in the midst of addiction is hard to obtain. So I just give up. So that, again, this cumbersome process to validate and verify yourself along with that barrier makes it defeating for folks. So again, I want to share that this is just a snapshot of the voices, and I believe that the equity is in the part of us listening to what the community has to tell us. Our work with our initial assessment, we found some ground truth with a resident saying, hey, I'm an older adult, I'm in my 60s, and I'm going to be struggling with housing for the remainder of my life. How is that equitable? Why is that happening? So going forward, our next steps is to publish the full health impact assessment reports with recommendations. I would encourage us to reconvene, if it's possible, to have Kim Gohuli and the team present back the full report, which is more than what I just shared today. But it is very profound in how we see community and what the opportunities are. She can also present back the recommendations for how to kind of address this equity gap issue in housing for older adults with queries. We're also applying for funding again to do an age-friendly ecosystem solution strategy. The thinking is that if we can wrap ourselves around the age-friendly ecosystem of queries and older adults, we would work with organizations that are either supporting older adults when they return into the community, legal supports that can help folks trying to clear up their record, but ways in which we can figure out how to solve this equity issue for older adults. And then going forward, there's hope for advocacy initiatives, and also working within the systems that are working with affordable housing to address this barrier issue. And we are in alliance with working with community partners, their housing partners at the table, that is working with us to understand this issue as well. So it's a collective community process. But again, I want to share, this is just a snapshot. And then when we think about equity in each of our communities, I want us to recognize that the equity gaps are unique. And when you are able to listen to the community voices of what's really happening. You find these ground truth that could lead you to a place of thinking about equity policy changes and equity policy solutions. So that's all I have. And I thank James for giving us the space to share what's happening in Springfield, and looking forward to learn more from other communities.
That's amazing, as always, Samantha. Thanks so much for sharing that. I know you said it was an aha moment for you to learn all about that. It was an aha moment for me, and I'm sure it was for a lot of people in attendance. But it's such a powerful example. When we put up the framework, we have this little bubble of public safety, of how things, focus areas to just kind of to use as part of the assessment process and listening. But maybe the traditional things that we've thought of as part of this network of fraud and abuse or financial exploitation or identity theft and things like that, it goes so much beyond that. And appreciate you sharing that with the group.
Thank you.
Attendees. And there was a Q&A that was aimed at your presentation, or I think it's in the chat, but thanks again for doing that. And we're now going to move on to our last presenter, Michelly Santos from UMass Lowell. Is going to talk about the work that she's been doing. So again, as usual, Michelly, you can provide a much better introduction of yourself and the work that you're doing, and look forward to seeing your presentation as well. Thank you so much. Just going to get Michelly visible.
Yep, here we go.
And there she is. Okay, thanks again, Michelly. Take it away.
Thank you. I don't think I can, oh, here we go. I am able to share. Perfect. All right. Hi, everybody. Thank you so much for that wonderful presentation, Samantha and Antron and James. It just showcases a lot of the awesome work going on. So I'm going to be presenting today a little bit about our age-friendly work in both Lowell and Lawrence. And these projects are in very different stages. So I'm going to start out with Lawrence because that is nearing the end of the first phase of that project. And in Lowell, we are just starting. And again, my name is Michelly Santos. I am the project manager for community research in the Center for Population Health at UMass Lowell. And I work with the project lead, Sabrina Noel, on both age-friendly Lowell and age-friendly Lawrence. So it was, here we go. Here we go. So it was actually very refreshing, Antron, to hear you talk about how important partnerships are in this work, because we've witnessed that firsthand. So with the Lawrence Age Friendly team, it consists of the Council on Aging, Martha Velez, who's also the director at the center, formerly known as the Senior Center, Groundwork Lawrence, Mayor's Health Task Force, the Office of Planning and Development, and we were pulled in as evaluators as we've worked on multiple projects with the City of Lawrence over the last 8 or 9 years. This project had a lot of support from Mayor Rivera, which really streamlined a lot of different pieces of this project. It made it a lot easier for us to get things done. Martha was able to text him. So if anything came up with this project, he knew right away. It made a world of difference. So for Age-Friendly Lawrence, we convened and we applied for a Tufts Health Plan Foundation grant. And the first 6 months was really kind of pulling in all the right partners and kind of establishing a framework that really fit the City of Lawrence. We did a lot of looking into the best practices. We looked at other exemplary communities, UMass Boston, we looked at a lot of the work that was done there. And based on that, we then sat down and we talked about what is needed in Lawrence. So we created our framework based on the WHO livability domains. And then we added an additional domain, which you'll see over here is immigrant services. And we felt that this was an area that really needed to be addressed. While it does come across in each domain, we felt it was important enough and needed enough attention to be its own domain. And that is kind of the beauty of pulling in all the partners, convening all the partners before actually starting your assessment. You start to understand really, the Council on Aging and Groundwork Lawrence, they're really involved with the community members. They hear what they're saying day in and day out. So they knew that this was something that was necessary for this framework. And so we added immigrant services in our assessment. And it just goes to show that age-friendly is, while there are frameworks and a lot of different resources out there, it truly is based on what the community needs. The best age-friendly projects really look at what is needed. You're able to adapt anything, and this looks different for everybody. We knew going in that we wanted to do a large-scale assessment, so that's what we did. But there are communities that are they're tackling one domain at a time, or they're maybe not tackling all of these domains, and right now, just transportation is a focus. So it's beautiful to kind of see all these different pieces come together. So in our large scale assessment that we conducted in Lawrence, we had a number of different data collection methods. We had a large community survey. I believe we are at about 800 surveys completed. And this survey was made available in English, Spanish, Vietnamese, and we had it administered in different languages as well. We found that we had much better responses when there was someone administering the survey rather than just kind of sending out an online survey. We also did a food assessment survey as part of the community food assessment already happening in Lawrence. One thing that's come across in all these projects that's been extremely useful for us is to really work with what's already happening in the city. So this food assessment was something that was already happening in the city, and we kind of added our expertise in the piece of the older adult. So while there is a larger food assessment that was occurring, we were also doing a separate food survey specifically focused on these older adults. And I recommend that with anything else. It's really good to assess what is happening already, what kind of plans are already in action, and putting an older adult lens on that as part of the age-friendly work. So as part of that, we also conducted focus groups, community forums, key informant interviews with different stakeholder groups. We did a parking lot assessment because that was something that came up as a concern where there were just a lot of different potholes and some different lighting issues with parking lots. We did an outdoor food retailer audit. We actually used the AARP walk audit tool, which I definitely recommend. And we focused on zones of higher older adult densities. So that was 4 zones to start out. And then as we proceed, we can do other zones in the city using that same walk audit tool. It was extremely helpful to us. And then Antron mentioned this, but we did do a bus use survey. So the mayor and Martha worked very closely to make 2 bus routes in Lawrence free. So it was free for a small time frame. And during that time frame, we went on to these the bus. We had one of our PhD students along with a community health worker who works at the senior center. And they both went and administered these surveys. And we asked some basic demographic questions, the reason for using the bus routes, and we assessed whether usership had gone up. As you can imagine, with the free bus routes, usership skyrocketed. But what we were seeing that was extremely interesting was that a lot of the usage was for young adults going to school and people getting to work. So I have on the next slide, because of these surveys, and kind of the point that we've reached in the assessment, we're in the really fun part of the assessment now with Lawrence, where all of this data we've collected is now serving as proof to get more funding and to make these things possible. We're addressing some of these issues. So with the free bus route and those surveys, we were able to secure or 2 more years of free bus routes. So they will remain free for 2 years. And that was just amazing to see, kind of from the beginning of conducting all of these assessments to now starting to see some of the changes and improvements that we can make happen because of that. And you might have seen some of these news articles that have come out talking about how Lawrence has paid all the fares for the bus routes for the next 2 years. And now there are other communities who are also realizing maybe this is something that we can do. Worcester is one of them. And I think Brockton, there has been some talk about it. So it's been amazing to kind of be an example in that way. And then I want to try and be respectful of time. So I'm gonna quickly jump into our age-friendly Lowell project and just talk about some of the differences in that project and how it varies from one community to the other. From what we learned in Lawrence was that there was a lot of capacity building to get this such a large scale project off the ground. So in Lowell, we looked at some other grant mechanisms that we could use. And we went with the Community Health Initiative grant from the Greater Lowell Health Alliance. And this was a 1-year grant. It was a much smaller grant, but it helped us to really establish a team of city officials and local organizations that were passionate about this work, were already involved in some of this work. And we really formed this nice team. And we created the age-friendly Lowell logo. We started to create the domains in the framework and decide what was important in Lowell and what was really needing a closer eye and for this assessment, for this also a large-scale assessment. Here we go. So some of the things that are unique in Lowell that we didn't do in Lawrence and that that we've seen in some other groups that we think may work in this community is we are creating an older adults action group, or OAAG. And that name is still subject to change because it's kind of a hard acronym to say. But with this older adult group that we're creating, it's going to comprise of a diverse group of older adults, somewhere between 20 to 25 is what we're hoping for. And these would be adults that are 50 years and older that live in the city of Lowell. And our intention with this group is to really ensure that perceptions of older adults are included throughout all phases of this framework. Antron, you had said this too, and I think it's extremely important in this work is kind of meeting the community where they are. And a lot of what we're replicating in Lowell is using structures that already exist. Lowell has a number of different organizations that really cater to different groups. It's an extremely diverse city. So we have, like, for example, the Cambodian Mutual Assistance Association. We're hoping that there will be a representative from the Cambodian Mutual Assistance Association that will serve on this older adult action group. And so that hopefully everyone's voice is heard. Concerns from all these different smaller groups can be brought back to this group, and it will shape our framework. James mentioned this also, so I'm not going to go into too much detail, but we are also utilizing the Healthy Aging for All toolkit. And this has been extremely useful in just making sure that we are checking all of our boxes and that we are crossing over to different groups that we might not have thought of or that are not initially at the table. As we kind of work through this framework and we start to look at different domains, we're going to use this toolkit to really make sure that the right people are at the table and that everyone is involved, and we can really make sure that each of these groups is heard, which of course is a lot more difficult with COVID, but it is making us, I'm telling you, all these different strategies that are coming to light that we'll be able to use as we go forward. So that's very exciting. And I listed both my contact information and Sabrina's in case anyone has any additional questions that we can't cover here today.
That's amazing again, Michelly. As always, again, thank you for presenting this work. Thank you for being a leader and example along with Samantha of showing the value of community listening, of partnerships, and focus on equity. And thank you for being a pilot site for the Healthy Aging for All Guide. So we know we're getting beyond the 2 o'clock threshold here, but just want to thank all of our panelists, Mary Catherine Randa from JSI for quarterbacking all of the Q&A and the chat. We're going to follow up with the webinar recording, slides, resources. It's going to get posted on the MHAC website, so people can view it again there. Or if you may have missed something and want to loop back to it, you can. We're going to share with attendees and in our blog the evaluation for this, but also the sign-up form if you'd like to be a part of Equity and Aging as a group, to allow us to highlight the great work that you're all doing in different areas. And I think we got a really great sample pack of all of these different issues today, and it's always encouraging and always great to hear how communities are leading and listening and just making a great impact. So we're going to continue on. We hope you'll sign up. We hope you'll be involved. Thank you for attending. Thank you to our panelists, and hopefully we'll hear from you all soon. Thanks so much.